My name is Ethan Matz. I'm a urologist. Specifically, I'm a reconstructive urologist, and I do male health, reconstruction, and genital prosthetics. So a fellowship-trained prosthetic urologist is someone who's had advanced training outside of residency in placing prosthetics or revising prosthetics. And it's important for a patient to choose a fellowship-trained prosthetic urologist because those are folks who have seen the complicated cases. And the placement of a prosthetic device isn't in itself complicated, but if you've seen the most difficult, most complicated cases, the easy cases are easier. A fellowship-trained prosthetic urologist is able to, who has already seen complicated placements or revisions, is able to know what might happen during a case, be able to fix that during the case, and avoid future complications. Also, generally in fellowship training, the volume of prosthetics that you get is quite significant. So in my fellowship, we did over 150 prosthetic cases, which is, multiple times what an average prosthetic urologist might do in a year. And that gives you a great library of things to choose from in case something does go wrong in the case or to avoid future complications. The other thing I would say about being fellowship trained is that sometimes there are cases that other urologists don't want to get involved in because they're too complex. And those are the cases that I would recommend sending to someone who's been extensively trained in prosthetics. So it acts as a referral center for other urologists to send cases that might be too complex to do out in the community. This is an answer to erectile dysfunction that works. It's a surgery, it's one shot, and things improve significantly afterwards. You don't need to be a last resort to get this device. So folks who don't want to use medicines or don't want to use injections or don't want to try an experimental therapy, and for those folks, this device is right for them. I also would say that there's a lot out in the community, online pharmacies and men's health clinics that'll charge folks a large sum of money to do experimental treatments that may or may not work. Here we know implantation of this device works. And so if you want a treatment of your erectile dysfunction with one surgery, with one option, this is probably the right device for you.